Dr. Deepika Aggarwal, Senior Gynaecologist and Obstetrician at CK Birla Hospital Gurgaon. I'm going to talk about a very common women health issue called as fibroids. Today in this topic, I'll cover everything about fibroids, like what are they, what causes it, what are the symptoms of fibroid, are they actually treatable, is there a medical treatment to it, or is surgery the only answer, can they cause infertility, and so on. Right, so let me start from a basic question: what is a fibroid? Now, most of the time the diagnosis of fibroid comes when we are going for a routine health check, and on an ultrasound scan radiologist mentions that she can see 2 or 3 small little fibroids. Please don't get alarmed, they are not cancer, they are just benign tumors of muscles of the uterus. Very rarely can fibroids be cancerous. All you need to do is, if there is a diagnosis of fibroid, please come and see your gynecologist. So these fibroids can vary in size and numbers also. They may be a very tiny seedlings that may be present somewhere in the uterus, or they may be multiple. The size of the uterus can be from a normal size to a large, huge uterus where your tummy can actually be protruding, and sometimes women may even start feeling it. They may start feel that their tummy is very heavy. What are the most common symptoms of these? The most common findings or symptoms that women can feel is either periods can become very heavy, sometimes they can become painful. We can also find very much heaviness in the lower abdomen, and sometimes you can have difficulty in passing urine. There could be back pain also. The bleeding or the periods can become irregular. So what are the most common causes of fibroids? We actually don't know what causes it, but there has been some hypothesis that it may be related to estrogen content in the body. Estrogen is a hormone that can lead to proliferations of the cells of the muscles, and these benign tumors can form, and therefore they may be found more in women who are high BMI, who are overweight women. Sometimes there are genetic factors also. We may see that fibroids can run in a family where a mother or a sister or an aunt has a known history of fibroids. It may be found in certain races like Afro-Caribbean races, and there is some role of lifestyle also, especially eating red meat may lead to formation of fibroids. Now, the next question that comes is there any treatment to it? Can we treat it medically, or do we need operation or surgery all the time? There are certain medical treatments that can be given. However, what I do want you to know is no medical treatment can completely take away fibroids from our body. We can give medications to ameliorate, to reduce the symptoms. For example, the most common medication that gynecologists use is to reduce the blood flow. That comes by name of tranexamic acid or Tranexamic MF. A lot of you might have heard that name. Having taken these medications doesn't mean that it will dissolve the fibroid. There are certain medications that we can give to shrink the size before we are embarking on any surgeries. These tablets are given especially in large fibroids so that the size can be reduced and it becomes easy to operate on them. Then comes the surgical treatment. Now, does all fibroid need surgery? No. It's actually very few fibroids would need surgery, and it typically depends on different things. What is the size? What is the number? Is it to do with the infertility, or are they causing symptoms? As a rule of thumb, we like to operate on fibroids which are causing symptoms and which are affecting our quality of life. Otherwise, we can live with the fibroid and they grow very slowly. Usually, we see these fibroids in women of reproductive age group, but they can be seen from age of 20, and usually they will start reducing in size once we go into menopause, which means when we go through the change in life. Thank you everyone. Hope you like this video. In my next session, I'll be talking about the treatment of fibroids, whether or not we can treat it medically, or is surgical treatment the mainstay of treatment. Thank you.